Tobacco-Free Futures Guidelines offers both an opportunity and a challenge for healthcare professionals to address what continues to be a major crippler and killer for the people that we serve, and that is tobacco. Since the U.S. Surgeon General's report in 1964, we still continue to see the toll that tobacco takes on our population. 1 in 2 users of tobacco dies as a result of tobacco use. Tobacco is responsible for 30% of all cancers that we see. Alberta's tobacco reduction strategy, with its 3 pillars of prevention, protection, and cessation, has seen significant improvements in the population, with the use of tobacco decreasing from 36% to 20% in 2010. Unfortunately, this improvement hasn't been uniformly distributed across all our communities in Alberta. There continue to be communities where the use of tobacco is over 40%. Tobacco use continues to cause premature death and disability in Albertans. It's estimated that the healthcare costs of treating tobacco range between $118 to $179 million a year. This works out to $500,000 each and every day that we spend on tobacco-related diseases. What is particularly tragic is that we have the knowledge and the tools to help our patients with tobacco dependency if we are only prepared to implement them. The interventions are simple but challenging, as they require changes to our healthcare system to implement the 5 A's. The starting point is with healthcare professionals asking each and every patient whether or not they use tobacco, to advise that quitting is the most important thing that they can do for their health, to assess their readiness to quit and interest in withdrawal support, to assist with behavioral and pharmacotherapy support, and to arrange for ongoing support. If you're a healthcare provider who sees 5 to 10 patients a day, using the 5 A's approach could result in 12 to 24 persons stopping the use of tobacco over a year. This would not have occurred without your support and involvement. This savings of lives is potentially one of the most effective interventions that you as a healthcare provider could do for your patients or clients. The intervention continues to benefit the client for year after year, and for some conditions such as chronic obstructive pulmonary disease is the only effective intervention there is to stop progression of the disease. I hope that you'll take up the challenge of implementing tobacco-free future guidelines as you care for your patients and clients. Thank you.